I place a lot of value on collaboration. One of the bloggers that I follow on innovation has indicated that he believes that collaboration is the active ingredient. It's the yeast for causing innovation to rise in your organization. So I just thought I'd share a little bit about some of the projects that we're involved in. Now, hopefully it will relate to what you thought we were going to talk about. So we were just all up here discussing, and you're going to get probably three very unique and different presentations. But just recently, some members of our tech team at MTM were given a challenge, and they were focused on finding innovation opportunities for automation in our manufacturing processes. And so you may know MTM as where you got your trophies for your soccer organization, or maybe you're involved in a company that we do your corporate recognition programs, or you see us with the NCAA awards or bowl game trophies and things like that. But for several years, we've produced what's called a patent plaque for Intel, and it's a kind of a performance recognition program that they recognize their folks for obtaining patents. And so our team actually was able to automate the process. We had this arduous process of having to go out and find a patent online, and then we would have to do some resetting of the type that belongs in the wording, and that's sort of the emphasis of this. Our recognition was misspelled there. So the idea, for this process is that we would be working with customer-supplied data and not rekeying their information, because we have found ourselves at a place where we put 2014 on something that we thought was 2014, but hey, they were recognizing them for last year. And the bad news was there were 4,000 of them that had been recognized. So, spelling and getting the year dates right and all of that is just, it's a major challenge for us. And so we're, anytime that we can just work with customer data, customer supplied names and information is a plus. So this team went on to develop a process to really just export the image of that patent into a format that, one, we didn't have to do any work with to manipulate or add names, and also eliminated several steps in just getting the proofs ready for production, which saves many man hours. So one of the things I think with innovation that the real value is in the idea. So we called that first project was called our Gold project, but gold seemed to turn platinum for us, and that was a good thing. So later on, the idea from this project, one of our customer care managers thought about this and how it might relate, to some other challenges that we have, and so he suggested to his manager that this gold level approach could, further facilitate some automation in processing information, customer supplied information. So they did what this slide says. They got a lot of people, because it involved a lot of different people across our organization, and they pursued this idea with several stakeholders from all across the company, and they developed another major innovation breakthrough, again saving a lot of time and money, and also keeping us from having to rekey or do something with customer supplied data. So what we find now is that this innovation is expanding into other applications. So, MTM we encourage collaboration to foster innovation and intelligent risk-taking. My next, I like this one here. You probably like this one too, don't you, Doug? Tear down the silos, get people off of their islands. Shane Smith's doing the videography back here, and at this conference last year, Shane and I attended pretty much a breakout session like this, and we saw a presentation from Bolt Construction on integrated or lean project delivery. And so we really did see the value. Shane and I talked about this a lot, just even during the presentation. They asked us to be quiet. We were talking too much, but too loud. But we were inspired really by the improved results that we were seeing that Bolt was having with their approach to project delivery. And so we realized in our award product line that we had designers designing, we had engineers creating, we had manufacturing or creating specs, we had manufacturing folks building the product, and pricing teams were determining costing, but we did find that we didn't have all of the right stakeholders involved in the process, and particularly we would get into manufacturing only to find out that, oh, we're going to have to go back and rethink how we're going to do this. So what we did realize, we didn't have a systematic approach to product development. So this is a major work in progress for us, and we are working to be more collaborative there. We've actually kind of rearranged, and this is sort of becoming more of a integrated work process. And it's really one of those ideas that we stole shamelessly from one of these conferences. So that's something that has will improve our agility. Okay, this third is a bonus slide because I really don't have anything to talk about on this slide, but it is, we've just spent 2 days actually in our organization, the last 2 days, in some pretty, what I would call, courageous conversation about what we want to do going forward. So it does require trust, and I think that's a big part in collaboration. And then lastly, another idea that we stole shamelessly, and it's really kind of a simple approach to what if somebody has an idea, what do they do with it? Is there a formal process? And I think at one of the conferences, maybe 2 years ago, Shane, did you come up with something with the Powder Valley? They had a process where you had an idea that you thought the company ought to know about, that you would just go see Sean. Well, in our case, it was we've appointed Shane, so we have a process now called Go See Shane. It's very simple, and Shane will help evaluate and vet out, and ultimately help prepare that idea to be presented to senior leaders. Okay, so one innovation idea that we developed, we had one of our surveys, employee surveys, we had very low marks. And we were actually quite taken aback by it and surprised that we had low marks on communication, because we thought we were really very, very good at communication. And so we developed a system, kind of an online suggestion box. Our tech team developed it internally. It's gone through several cycles of refinement, but all of our employees, they can submit questions, ideas, express gratitude, they can complain, and or share good news, and they have the option to indicate the location that they work in or to not indicate that. They also can provide their name, or they can remain anonymous. And it really is anonymous, because I can tell you, I've tried a few times to find out who wrote this one and who wrote that one. I'd really like to speak with them in person. But our senior leaders gather up and we collaborate on the responses, and then those responses are published every Wednesday. We put out the questions, we put out the answers, and I think, if we miss something, people let us know about that. So it's been really something that's been pretty well integrated into our daily lives at MTM, and all the information can be just accessed from our internet. So we've been focused on having an open environment. We had an open door policy. We changed that. We call it now, it's part of our culture. It's an open door culture, and if you want to talk to somebody, you can. And on that communication, we just, last week, I guess a week ago today, we had an onboarding luncheon, and so we brought in, there were probably a half a dozen new people, and Dave Jr. and I had lunch with them and some of our HR staff, and we talked to learn more about them, but we advised them, and we told them about the 360, and we told them about, if you have an idea, go see Shane. And so just having that open, two-way communication are other ways that we believe will help foster innovation. So that's about all I got. Aaron?
Great. Thank you. Sean Hine is the Executive Director of the Oklahoma State School Board Association and former Enid Public Schools Superintendent. Please help me welcome Sean.
Thank you, Aaron. I have 2 hands and 3 things. That works for us. We're going to talk about a big systems thinking today, and as a former teacher, I'm going to talk to you about what I hope you get out of the 10 minutes, because I have 10 minutes, and Aaron's in charge of making sure I stop in 10 minutes. Usually I do this in about an hour. What can we learn together? Well, number one, I hope you get an understanding of behind our initiative, our education initiative, that systems thinking, and also 2 other things. One, I challenge you to become part of our system, our initiative, and number 2, I hope you can see how you can take this and use it in your own system. So I am Sean Hine, Executive Director for Oklahoma State School Boards Association, and if you don't get anything else out of today, you get a parting gift. You get our engagement guide, thanks to our partners at Schnocky Turnbow who helped us with this. One thing we learned in our initiative as we went through a 2-year process was we're not marketers, we're educators. So our initial document was 144 pages full of lots of research, because that's what we do in education, we research. And so we started talking to people, and then we did a summary of the 144 pages. It was 36 pages, and then I started meeting with people from Oklahoma City Chamber, the State Chamber, and other business organizations. And they said, you know, with us, we want something really small. So this is what we got to. We engaged the professionals, and we got to something that is the community engagement guide. It started about 2 years ago with the Oklahoma State School Boards Association and the Administrators Association to talk about leadership in public education. We've had a lot of education reforms. How do we bring people together to have an initiative to improve our system? I mean, we have a lot of systems in this world, but there probably aren't any much larger than public education. This is much similar to what I would have done as superintendent of schools with 1,000 employees. Friends from Jenks Public Schools, I had some educators in the room. They've been through the Baldrige model that we've worked on how to tie in some of those processes. So our discussion over a 2-year period was what works for public education. We know change is needed in public schools. We know we need to improve. That's not a negative. We all want to improve our systems. You want to improve, you're here today because you want to improve your business and your model. Usually what needs to improve on me is my weight loss program. But in our system, we know things need to change. But our challenge is to identify what changes will be transformational for student achievement. Change for the sake of change is no good. Change because it sounds good, it's a slogan, it's a buzzword, whatever. That's not what works for children, and not what will work in your business for your employees. It's individualized by individual groups. So from there, our vision statement was all Oklahoma public schools will learn in an environment that maximizes their potential and develops them as leaders who will contribute to a meaningful life of democracy, propelling our state forward. That sounds good. We all have a vision statement. Some of you live by it, and some of you it's on your wall. I mean, I understand. I've been there in both cases. What we tried to do was talk about how do we help, what will work to help make our students, our citizens of Oklahoma, college and career ready. And a big capital C on career, because I don't think we're doing enough with our business and industry about what do you need for employees. What does that look like? We have those conversations a lot. Well, we don't have people coming to us ready to work in our business. Well, we need to have those conversations together. K-12 education, career tech, higher ed, and business and industry need to come to the table together. And that's what this is all about. This is about bringing groups together to talk about how do we improve what's going on in our public schools. And a big part of it, as our friends from Jinx are here, we can hold them up as a shining star in public education. A big part of it is how do we grow on positives? When you build a business, when you improve any organization, it's a lot easier to improve by looking at your negatives, looking at your positives. But when you work with your employees, you want to build through encouragement from the positive. One thing we haven't done a very good job of in our business is talk about the positive. So I have to do this every time I speak, whether it be 10 minutes or an hour, to talk about one positive in public education. A month ago, the Southern Region Education Board put out their annual report on the 12 states in the South. Oklahoma is in the Southern region, on ACT scores. Okay, I've already given you a little bit because I said it was positive. I shouldn't have done that. But we hear a lot about failing schools in Oklahoma. So their 12-state report on the 12 states that use the ACT for college entrance, out of 12 states, who can tell me where Oklahoma ranked? Anybody have a guess? Oklahoma, 12 states. Number 1. We had the best ACT score. Our seniors, graduates of last year, had the best ACT scores in the 12-state Southern region. Does that mean our education system's perfect? Heck no. We need to improve. We need to strive to be the best in the nation. But that does show the improvement. Over the last 5 years, we have increased the number of students taking the ACT, the percentage taking it, and the scores have improved. Those two things don't often go together. So that means we're making progress. What we have to do is identify the weaknesses and continue to move forward. So the document you have before you, again, is a very small summary. The website's on the back with the full document if you want some nighttime reading of 144 pages of research. When we went through that process, and what we're asking each and every one of your communities to do, which you see, some of you are in the Oklahoma City area. Rob New, Oklahoma City's new superintendent, is doing this exact thing with Oklahoma City. The Great Conversation. He's bringing stakeholders together. Tulsa is doing the same thing in Tulsa. Impact Tulsa. Bringing people together to talk about what we need, what will work to transform education. And the guiding question, the essential question is, if you implement that idea with fidelity to a high level, will it make a difference for our schools? Will it transform students? So many times we talk about the things that don't really matter. We spend time talking about the simple things when we should be spending time talking about what really works. And as a guy who works with school boards, I'll leave this one with you. I had one school board member, after we had this kind of talk, said, you know, we spent 4 hours at a school board meeting talking about whether the gym floor should be blue or red. I said, you know, when you were finished, did that transform any educational practices for students? Did that help them get into college or a better job? No. So we really want them to think in terms of what will transform education for children. So our next steps, and I hope that you'll join me in saying yes and being a part of this in your community and at the state level, is to use that guide, bring stakeholders like yourself together, talk about what works in education, what our needs are, hone in on those things to make sure we help improve our education in Oklahoma. Because we know the driving force in economic development, the cornerstone of that is an educated workforce. So we have to start in that arena to continue to move forward. And I think I made my 10 minutes. Thank you.
Mentioned before that after we hear from Marty, we will have a time for Q&A. So we'll be passing the microphone. Also, feel free to use Twitter and tag OKQuality1 and use hashtag BestPracticesOK, or we'll be doing a live ask with the microphone. So Marty Jordan is Regional Vice President of Quality and Performance Improvement for SSM of Oklahoma, which includes St. Anthony Hospital, Bone and Joint Hospital at St. Anthony, St. Anthony Shawnee Hospital. Her area of focus for the last 13 years has been quality, patient safety, and performance improvement. Please help me welcome Marty.
Well, I see a lot of familiar faces in the audience, from instructors to students and the team leaders and examiners. But I want to teach you something first that, so that when you leave the room, if you forget everything else we say, you'll remember this. So, I work in healthcare, so obviously infections and that sort of thing is a concern. So I'm going to teach you how to minimize your risk of infection. You ready? This is a CDC recommendation. You know how we normally shake hands? Well, this CDC recommendation is a fist bump. So that will minimize your risk, because we don't know when you shake someone's hand how, where that hand has been. So that is really hard, though, to change a culture. It takes 3 to 5 years, right? So I'm left-handed, so I have to do everything backwards. So I would like to first, for those of you that have not gone down the Oklahoma Quality Award or Baldrige journey, sometimes when we speak these words, they don't mean anything to people, quality. So I thought I would give you a definition of innovation, which is a new idea, device, or process, application of a better solution, something original that breaks into the market. So it could exist somewhere else, and if we apply it in Oklahoma, then it would be innovative for us. Or it could be something that we completely create ourselves. Give you an example. St. Anthony was the first hospital in the Oklahoma Territory. If you think back, how did you get health care back then? A doctor went to a farm or a ranch, right? Well, think about how the doctor even knew to go there. There were no phones. There was nothing like that. So somebody may have had to travel miles to tell the doctor that, somebody on a farm or ranch needed care, and then that doctor may have had a whole bunch of customers, and it might have been all day or 2 or 3 days to get there. In that time, he may not have brought the right supplies or whatever, he or she. And then we had some sisters that came to Oklahoma City, and the current government asked them to open a hospital. Well, think about how innovative that was. You went from a doctor going out into the community to people coming into a building, and so there would be more opportunity for that doctor to take care of people. So that was pretty innovative. And that's just kind of how Oklahomans are. We're very innovative, and we may have to go and find something new in another state and bring it back here, which what Roger said about stealing shamelessly, that's what we're all about with best practice sharing. And then intelligent risk-taking. Now, I pulled this off the internet, so Doug may not agree with it. It may not be in the Baldrige criteria, but it's taking the right risk at the right time in the smartest way possible. So how does leadership create systems thinking to be innovative and take intelligent risks? Well, first you got to know who you are, what you are, where you want to go, and then how you're going to get there. And then once you get there, what does that mean? And how are you going to sustain it or continue to improve? So to me, that's the leadership, systems thinking for leadership for any organization. And then you also have to communicate that message down to every level of employee. And really that's your mission, vision, and values. So if you raise your hand if you're a Baldrige examiner, a quality award examiner, or anybody that's been in that position. Okay, so anybody brand new that all this sounds kind of like a new language? Okay, so I'm preaching to the choir. Okay, so most organizations do develop a mission, vision, and values. Well, if you're going to be innovative, what does that mean? In our organization, we test for innovation. We have, for the leaders, they go through a series of, I wouldn't call it psychological profiles, but they do look at, are you innovative? Are you a risk taker? Are you risk averse? And if you are, then how would you get where you're going if you need to be innovative and taking risks? So it really takes a whole combination of people to create a system and then direct a path on where you want to go. I myself am not much of an innovator except for processes, but we do have some great people in our organization that are risk takers. One of them is our CEO of Oklahoma, and he, with his vision, has developed these health places. And we're getting ready to open 2 more. So what we're doing is bringing healthcare back to the community and making it more convenient and easier for someone that needs that service to go into their local community. And that's a big risk because we have a lot of hospitals in this town. But again, you have to have commitment to a process. And to answer the question about how do you bring a team together and get results out of them, well, again, it takes all kinds of people with all levels of attributes to create a team. And if you've ever been a team leader, when you put together a team for the first time, it's kind of a difficult process because you may have quiet people that have brilliant ideas but don't want to say it. You may have people that want to talk all the time and never let anybody else in on it. And then you have to bring them along to a common goal. So whatever your project or process is, then you've got to create that team to form, storm, norm, and then transform. And so that's a hard process, especially if you haven't done that before. But you got to have people that can help you identify where it is you want to go, what your barriers are, and then help you if your team needs to have those barriers taken down and continue along the journey. All of this requires, in my mind, how do you know if you're successful? You have to measure, right? So however you decide you're going to measure to know whether you're successful or not, and to validate those results, and then get the same result over and over if you want to continue to grow. We use the Baldrige criteria. I think it's a basic, great model as far as even if you're forming a new organization, it gives you great ideas on how to create a culture and to sustain it and grow and become successful. But again, to be a team, to innovate or take intelligent risks, you've got to have some level of accountability. And I think that's a challenge for a lot of organizations, especially if you have a large number of employees. So we have the same mission statement for 24,000 employees and thousands of doctors. We have the same philosophy. We have a passport where we've identified who we are, what we are, where we're going, and how we're going to get there. And then we have lots of things that we measure. Well, in healthcare, the government is also measuring us. So they are handing down many challenges to healthcare organizations. And so what your old traditional hospital model is changing. The pressure is on to reduce length of stay. So we're also looking at what ways can we innovate so that the patient doesn't have to be in a hospital. Can we provide service in their homes? Think back to the old doctor in the Oklahoma Territory. We actually have doctors going into people's homes now. In New York, I read an article where one doctor, he's only got on his iPhone, he takes credit cards, he goes to your home and he takes care of you. So there's lots of requirements for innovation now in healthcare. We're going to have to come up with some new models to reduce cost, to be more effective, and really focus on wellness for the future. And then, of course, like I said, measure consistently. You can go now to you can go to hospital.com, pretty soon there'll be physician.com, and you can look at how hospitals are measured against each other. And then many hospitals we've got probably 75 metrics that we're looking at, and some of them overlap. But again, part of that is learning to be innovative and improve the processes so that we can deliver a great product or prevent you from coming to a hospital and helping you to be accountable for your own healthcare needs. Okay, that's my presentation. Any questions?
Okay, thank you, Mark. So this is our opportunity to ask questions of the panelists, and feel free to ask a question for anyone, panelist specifically, or if you'd like to pose a question and hear from all three of them, that's fine. So now I'll turn it over to you. Who would like to ask a question? Right here. Let me get the microphone.
Innovation is pretty in-depth in the Baldrige criteria, and I was wondering what approach do you have to get innovative ideas from your workforce that will trickle up to leadership and that can actually be put into place?
are you asking me or all of it?
Either one.
Like Roger mentioned, any employee can come forward with an idea. They can submit an idea online. They can tell their supervisor. We have a process for reviewing those ideas. We send people to conferences. We read in healthcare magazines. There's all kinds of methods. There's no one method that's successful, but we do listen to our employees. And you know, we have town hall meetings. Like he said, it's two-way communication, and I think that's a really important aspect of any business, because sometimes the best ideas come from your employees.
Great. Who's next?
For Roger, you talked about the 360 communication. Do you have any tools in place to make sure you get feedback and give back answers? Any tools in place to make sure you don't lose sight of maybe projects or things you maybe want to stay on the radar?
Okay, our 360 communication is a communication tool where we get feedback from our workforce, questions and ideas and that sort of thing, and then we respond back to them. So, Rudy, I think are you asking, I want to make sure I understand your question you're asking, how do we keep up with the important things that we intend to do?
Yes, things that may lead to other projects and things like that.
Okay, and I've alluded to this. We spent 2 days yesterday actually in sort of an intensive short version of some strategic planning, and so we document whenever we go through one of those kind of processes, you know, to list what our objectives are, the things that we want to keep up with. I don't know, does that answer your question?
It does.
Missed having you on our team.
Is there someone in the back? Okay. As I make my way there, Sean, can you talk about what you see as one of the most significant obstacles when undergoing a quality journey?
Well, I'm going to give Roger a little credit with his slide on culture and climate. And the most important thing in any organization, whether it be statewide, like we're talking about, or in my organization, in my office of 20 people, or yours, is the culture of the community, the culture of the workforce. If they don't feel like they can have open dialogue on issues, if they don't feel like they can sit down in a meeting and have that discussion about what's important to them, then you're really not going to reach your maximum potential. What we do is one of the things I do with my staff, a leadership team and a staff team, like most of you, we use Google Docs. Pretty simple. We use a Google Doc sheet where anyone can put an item on the agenda for our next meeting. They can go in, they have access to edit it's just a spreadsheet. They can edit the spreadsheet, put down the item that they think we need to discuss, and kind of lead that discussion. And it gives them that ownership from the mail clerk up to the CEO.
For Roger, over here. Your comments on silo elimination and no islands. Can you describe a little bit more in depth your process that dealt with silos and the resistance that comes from when you're trying to break those down?
Dealt with, we're in the process of dealing with them. It's we're a 43-year-old organization, and so we're having to kind of go back and rethink how we do a lot of things because of how much the world has changed and particularly how our business has changed. From the resistance, we didn't have any resistance. Anybody believe that? We have a lot of conflict, a lot of those courageous conversations, and we just try to talk through that as respectfully as we can. What was the rest of your question? I'm sorry.
That was it.
Oh, amazing. Okay. I have a question for y'all. Did you notice that all three of us are left-handed? What are the odds of that? Huh?
Question for Sean. You talked about career development, which I think is absolutely important within the school system. What are you going to do to develop people other than college education, to show them careers in manufacturing, et cetera? We are missing that now for the last 3 or 4 generations.
Amen.
As a result, we don't have people who are ready to take the place somewhere else.
Amen. I agree completely, and that's one of the big things that we're doing. We brought our career tech systems in, talking about breaking down silos. Nobody has any taller silos than higher ed and career tech and common ed, and we don't want anything to do with each other. So the first thing we had to do, and we have to continue to do, is break those down. Our career tech system has the ability to adapt to the needs of their commercial industry. I lived in Enid for the last 6 years. They're working for the nitrogen plant, they're working on the wind industry. I mean, they're doing things that are needed today in that area. What we need to do is make that a larger scale process, so you as a business owner, you as a business leader can go talk to the career tech system about what do you need, what skills do you need. For one great example is Metro Tech has an agreement with the Air Force Base, and if you go through the Metro Tech system, you're guaranteed a job at Tinker. That because they know you're going to be ready for that job if you go through that program. Those are the kind of things we need to be able to do for more business and industry, because, as you said, skilled labor is what we really need, is one of our biggest shortages, and we're missing the boat as we continue to. I mean, it's important as a college graduate, a first generation college graduate, it's very important that we have as many students who want to be ready for college, but we also have people understand how important it is to have skilled labor, and that is a very meaningful job and a meaningful, it could be a happy life if that's what you want. My oldest brother is a welder, and my other brother is a superintendent, and I was a superintendent for most of my career, and the welder some years makes more than both superintendents together in all the degrees we have. So it's important to know that it's not all about just college.
Yeah, Sean, I'd love to hear from you from an educator's perspective for this question, but Marty, you also kind of hit on it as well in your presentation. So sometimes as a leader, the areas that we're hungry for innovation aren't necessarily sexy. They aren't necessarily things that employees get excited about all the time. And so my question is, how do you try and target innovation without being prescriptive, or without maybe putting people in a situation where they don't feel like this is an area where we need to concentrate our focus, our energy?
Good question. Some of the areas that I'm involved in are, process improvement type issues, and you're presented with a challenge, and then you have to figure out how you're going to get there. And sometimes it's not always about having the people that have the most expertise to be in the room and on the team. You need to bring in others that have different perspectives. And so in creating that kind of team, that they can help you, challenge you for innovation. And in healthcare, really, reduction and simplicity is the process that we're looking for, because the more steps you have in a process from a patient perspective, the more likely you are to have patient harm or a process failure. So we introduced Lean Six Sigma into healthcare, which I know has been in manufacturing and all many areas, other areas. We also introduced, have you heard of crew management in the aerospace industry? That's the process they use to help planes not fall out of the sky, because it's a standardized, consistent process that everybody buys into, and they follow that process. We have introduced that into healthcare. So you can take other ideas from other industries and apply it to your own, regardless of the area that you're in. And sometimes it isn't sexy. It's a matter of roads, standardizing, and then going back in and making sure those processes are implemented, and then auditing for results to make sure it's truly deployed. Does that answer your question?
Yeah, that helps. Thank you.
And just to follow up, because you had asked about us, that's, as an educator, that's probably the toughest thing we do. And probably the toughest thing in any business is those things that aren't sexy, but that if you implement them to fidelity, that it could be transformational. It's going to be great for the entire system. One thing we do is try to have somebody, or what I do personally, is try to make sure I have somebody that owns that. We call that, your monkey. I don't know if any of you read Todd Whitaker's book about shifting the monkeys. Well, the monkey is a responsibility. I want someone to have that responsibility and someone to bird dog me with it, and also find somebody that has the passion for that. Even if it's not sexy to most of it, you'll have somebody on your team that really has a passion for that, especially if you give them ownership and give them some freedom to work on.
I have a follow-up question for you and also for Marty, kind of along those same lines. You both come from industries that, in my view, are very data-rich industries, healthcare and education, where data measurement, data tracking, data reporting is a requirement. Do you find that, do you believe that is an asset as you go to a more systems-based approach, or do you find that as an obstacle?
I think it's a great asset. I think that's one of the things we have to get better at is making data-driven decisions. And that's one of the areas we're working with higher education, and their research arm should help us as a team. They do a lot of research on what works in education. And we have, as you know, we have data from student achievement to poverty to attendance to whatever you want. In our world, we have data. It is important, and it works well if you use it. And I think for most of our history, we haven't used it as we should.
It's both. Healthcare has way more data than we know what to do with, but from a systems perspective, and let me give you an example. Hospitals now have to satisfy their customers, and that's measured. So if you're an inpatient, we send you a survey, every hospital in America, it's a requirement. And so we want your feedback, both as an individual, as a hospital, but as a system. If you could roll up that data and look at, across 4 states, what are your patients, what are your customers saying about you, and what can you do to provide the service they need in a timely fashion, in a consistent fashion. And so from that perspective, having data that you can roll up and look at from the system can be very, very beneficial.
Aaron, you left me out of that question, but if you don't,
Please jump in.
I haven't had a good question.
I'll take it personally.
No, in our organization, we've been more on the side of, for a lot of different reasons, but probably all could be, it's sort of embedded in our culture, but it's something that we need to change is more of, I think, and I feel, and that kind of drives decisions. And so we're very focused on, making sure that we do have data-driven decisions. Sometimes we lack some of the data that we need, and we're learning how to overcome those challenges. But I saw on one of the slides that we had in our presentation yesterday, it's in God we trust, everyone else bring data. And I look forward to that, kind of sharing that with our workforce as time goes on.
We have time for another question?
Well, as you're waiting on that, I do want to make one point, because I think we always talk about the 3 R's, and we use a lot of data, but the most important thing in our business, and I think the most important thing in improvement and success and happiness in any business is the biggest of our relationships. You can use all the data you want, but if we don't get people to believe in what we're doing in our business, if we don't build relationships with students and parents, then we're never going to be successful.
Anyone with the last question?
Hi, I'm fine. In MTM has an opportunity there to have a skilled grader, for example, and career takes have the ability to be able to train these students as skilled engravers for MTM. We now have an opportunity to put a student on the correct job. There may be some challenges there from the feeder school, such as the different criteria a student must meet to get to the career tech. Are you aware of any innovative abilities there or challenges of those students being able to put a career tech and be able to overcome that?
And his question was about having the ability to get the students into career tech so they can learn the skills. Yes, that's one of the things we're working on, is making sure we break down the barriers to getting into the career tech system so they can have that training. And that's part of the thing we have to be careful with our reforms, our college-ready reforms, of saying you have to have 4 years of math and 4 years of science. Well, we want to make sure that we don't beef up the reform so much at their high school that they can't go to the career tech to be a welder or heat and air or electrician or engraver or whatever that skill is. So what we're trying to do, we're starting to embed those high school credits in math and science and other issues into those courses at the career tech. What better way to learn science and math and some of those than in the skills, hands-on learning, with whether it be electrician or engraving or whatever is in that program.